Thank you, everybody, for joining us today to hear Centura Health's experience in improving its outsourced relationships to increase productivity and performance. Our presenters today will take a 4-year look back discussing Centura's initial phases through their latest initiatives, and they will also share their industry insights and best practices around this topic. And we're also very pleased to have Colette Pears of Centura Health with us today, and she is the Director of Business Operations.
I'll give you a little bit of background of Centura Health. We are the largest healthcare provider in the state of Colorado. We have 13 acute care hospitals, $2+ billion in net patient revenue. We have 2 actual sponsors. We are Adventist Health Systems and Catholic Health Initiatives. So we do have a very streamlined revenue cycle architecture here at Centura. We have one single centralized business office. We handle both professional as well as hospital billing out of one centralized billing office. We also have centralized coding for all of our physician practices, own physician practices, as well as our hospitals. And we use Meditech as our patient accounting system, and LSS, which is now Meditech, on the physician side as well. So I'm here today to speak with all of you because Centura is a believer in what Conant offers, and we're a believer because the proof is in the pudding, right? And so we have actually, as a result of Conant, seen a $20+ million improvement in annual improvement in cash. The improvement is continuous. It wasn't a one-time improvement. We've continued to see increases since 2009. We've experienced resource savings, and we have much more control over our reporting capabilities, which drives accountability both with us and with our vendors than we ever had previously. In June of 2008, we did what one would call maybe a reboot or a complete overhaul of our vendor management strategy. And we really, our phases continue on today, but I'll talk about, between 2008 and 2009, we had a phase 1 and a phase 2. And the first piece of our phase 1 was selecting, we knew we needed a technology vendor and a technology platform to help us through this reconciliation process and get us where we needed to be. And so obviously that technology platform that we selected was Conant and their agency manager product. We'll talk a little bit more in detail about this in the coming slides, but we, as a result of putting this vendor platform in place, technology platform, we needed to update all of our policies and procedures, or to be quite honest, just create policies and procedures, not necessarily update. And we decided that we were going to go to RFP for our book of business. So Centura, you said we are $2+ billion of net pat rev. We have a pretty substantial book of self-pay business, balance after and self-pay. And so we did conduct a very thorough RFP. I want to say we had 10+ presentations after actual presentations to come. And it was a long process, but a very worthwhile process. You have to be committed to the process, and because it is a time investment and a resource investment. So after coming out of the early out RFP, we entered into phase 2 of our journey, which was bringing all those vendors up, and then we brought in phase 2 with eligibility vendors. So we were using a Medicaid eligibility vendor at the time, as well as adding bad debt into the platform. So that's kind of our first phase 1 and phase 2. We'll talk about 3 and 4 later. The Concept's platform is it's very innovative. It's very flexible. It's rules driven. And it's rules driven based on policies and procedures. So that's your technology is only as good as your people and process. And so we really needed to spend internally a lot of time around people, process, and policy. And so, but in doing that, we were really able to establish what we wanted, how we wanted this to work. What we quickly found out is we could manage really any type of vendor, whether it be early out, bad debt, secondary bad debt, Medicaid out of state, international collections. It can handle more, if you want to do like a champion challenger model, we have 2 different early out vendors that we use. Lots of flexibility in the different types of vendors that it can handle. It also, based on, I mentioned it's a rules engine, so you can say, okay, I want my account with the early out for 120 days. If there's been no patient contact or payment plan established, at 120 days, recall it and now place it in bad debt. And Conance handles all of that for us, so we don't have to have people manually doing that anymore, which is a huge benefit of the system. It keeps the vendors honest. It keeps the patients, receiving that continuous communication from us, and really streamlines that process. One thing in the beginning that it's not I think our IT folks would be one of the biggest proponents of this. Instead of sending files to every single vendor, they send one file to Conance, and then Conance, weeds through that file and sends the different vendors what they require. And so it's been one single connectivity for our IT department, and it makes changes very straightforward. It makes reconciliation a lot easier, and really a reduced burden on their resources, which can be then deployed in other areas. It's got work queue communication. So when we say that, for example, you have a patient dispute and you need to have the vendor look at something. Instead of sending an email and it getting lost in all the other email, you send a work list communication, and then you clearly have turnaround time tracking, and you know when it's been resolved, you know when it's being worked. It really streamlines that process as well. We've got great reporting. We'll give some examples in a minute. And then third-party commissioning calculations. So no longer do we need to make sure that our vendors are, our collection fees are being charged appropriately. Conance helps us do that. Some of the ways that Conance clarified how we do our business is when do we place an account. So it helps us clarify if there's certain things within your hospital information system, certain flags that you don't want an account to go, maybe it's a risk management account. You can exclude those, fairly simply in your file indicators to say, okay, I no longer want these accounts to be placed. So it really allows you to have control over what is going and what is staying. Recall timing, it handles all of that for you. We found previously we had no idea when accounts were coming back to us and going, to the bad debt vendors. It monitors extension limits. So if the early out vendor is asking for an extension past that, 180 day or whatever your days are that you allow it to be an early out, you have to approve that extension. If a patient's on a payment plan and they haven't defaulted, it keeps it in early out. It doesn't qualify it for bad debt, and so it's a huge patient satisfaction. We used to have so many patient complaints where we had sent them to bad debt inappropriately. They were making payment plans and it wasn't signaled in the system, and so they got placed in bad debt inappropriately. Bankruptcy, it helps us manage our bankruptcy and death certificates. It also, with all of our vendors, we have standards of work effort that we've developed. And so the vendors have to send back, so let's say on certain thresholds, we require at least 2 statements. The vendor has to send us back status codes to let us know that they've sent 2 statements on an account, or maybe it's 4 statements. But it allows us to manage what our minimum, what our standards of work efforts are with our vendors. I talked about the communication queues. If there's a bill dispute, we can communicate back and forth. I say we, between the Centura Customer Service Department and the vendor, we can communicate back and forth to make sure that we're both aware of what's going on with the patient's account. It allows, the use of credit scores and credit files depending on, your vendors and what your methodology is. It allows for the processing of that. We also use, just recently, we went on live July 1 with charity eligibility using a tool called PARO, which allows us to do presumptive eligibility for charity or our financial assistance program prior to the patient being placed in bad debt. Every self-pay patient is screened, which has, which will lead to increases in charity and decreases in bad debt. So that's kind of how we've used Conants to clarify our technology platform. You can basically, as far as reporting in Conants, you can basically get whatever you need out of there. You can get collection rates, you can get deficient demographics, you can see what, your placement numbers, pretty much whatever you need. If it's not there, you can find a way to get it. Steve, I don't know if you have anything to add on the reporting. I know we gave kind of just high level, but really the takeaway is whatever you need, you can pretty much get. So.
Yeah, the only thing I was going to say is I think this is a picture of replacements, gross assignments, and recalls. And then there's a piece of it which is around activities to your minimums collect, and then reconciliation, how to understand what the nature of the reconciliation is, as an example here. Here is commission tables and understanding how commissions get processed. And these are all, you can see how the various drill-ins, and you can look at balances or agencies or dates.
So there was a couple different impacts on our cash improvements that we saw. Our reporting team, we downsized by 2 FTEs. Not only did we downsize, we downsized or / redeployed resources. Not only did we decrease FTEs, but our reporting and reconciliation improved. So we were truly paying for what was collected, not just what we were invoiced, if that helps clarify. IT support work reduced because now we're just sending the one file. We have much better communication back to our patient access teams through tracking the patient disputes than we ever had before. So as you can see, when you're looking at early out monthly cash collections for 180 days, you can look at where we were in 08, and then when we ended this graph was 09. And you look at monthly cash collections, they definitely are increasing even in conjunction with increased volume. So I think that was the question before. So yes, we did see increases, not in taking into consideration growth as well in placements. So I earlier mentioned phase 1 and phase 2 and said we'd touch on phase 3 and phase 4. Phase 3 was physician billing, and if anybody on this call does anything with physician billing is nothing about it is straightforward. And so Conants, again, going back to flexibility, our current information system being transaction-based, it's just a much more, placements are just a lot more complicated as far as scripting logic, and Conants has been able to be incredibly flexible with the with our files and the information that we're able to send to them. So we have been up and live with physician billing since September, December timeframe of '09. Leveraging the capability for physician billing, high level, we're realizing more cash faster as a result of the implementation of Conant and getting the accounts to the vendors. What we're working in right now in phase 4 is payment plan modules, creating and developing a payment plan module. So if a patient has, their self-pay, or let's say their charity, our second phase of this will be balance after insurance payments, because we are really focused on improving point-of-service collections. But right now, we are working with Conant. If we have a patient who wants to do a payment plan with us internally and we have their credit card, we flag the account and it doesn't qualify for it to place with the early out vendor because we're collecting the money internally and we've got it set up on a payment plan through our credit card vendor. And so we don't have to pay a commission rate on that. We've already established that with the patient. We've already gone into that agreement. We've set up technology. We've set up, again, rules that says, okay, if a patient doesn't pay for 60 days, the account automatically recalls from the payment plan and now is placed with the early out agency to start collection efforts. So again, all of that can be specific to your individual organization's goals. Automated presumptive charity, we talked about our use of PARO. The state of Colorado on August 1 came out with Senate Bill 134, which requires all self-pay or uninsured patients that have received emergent treatment in a Colorado hospital that are 250% or below the federal poverty line to be given some type of financial assistance. So our implementation of PARO came at the perfect time because we are in line with what the state regulations are. And what happens is when an account is recalled at the end of their early out placement, it runs the Conant sends it then over to PARO to determine if the patient is going to be eligible for presumptive charity. If it is, it hits a work queue for us to take the adjustment. If it doesn't qualify, then it automatically places through bad debt. So really allows us to streamline that process. We're also, on October 1, Centura brought in-house our Medicaid eligibility program, but we are having a secondary vendor come in behind us just to make sure we aren't missing anything. Conant is going to help us manage that and manage the commissioning of that as well and all of those placements. So again, IT loves it. We add a new vendor, we add a new process. We just build on to the current file that's being sent to Conant, and then they use their rules to give it to the appropriate vendor. Quarter over quarter, like the trend lines on this graph, you'll see quarter 1 and quarter 2 are high, quarter 4 is low, follows kind of a patient's, pay a lot when your deductible is high, so it follows that. But it allows us to track it and trend it and see not only year over year, but quarter to quarter, everything's tracking in similar proportions. So.
I think Colette, this also answers the question of is growth adjusted, because yield rate it's a ratio. So as you can see, the green is higher than the blue, which is higher than the red. So that the yield rate is going up even as the business is growing as well.
So our improvement is kind of twofold, right? We're bringing cash in faster and earlier in the collection cycle. We are not only collecting more cash in the early out process, but we're also moving, when you collect an early out, the cost is a lot less. So not only are we collecting more money, we're collecting it at a lower rate. So that's kind of been the two-prong approach to where we're seeing those yields from. So we really have made a complete transformation between 2008 and 2013. while we have a lot more vendors than we did before, we had 5, we now have 8. We have one point of connectivity. We have continuous process improvement. We have a vendor management strategy. We are focused on improving vendors' performance, and we take the feedback that the vendors have for us and share that out to our facilities and practices as well. We have hospital and physician on a single platform. Our team of reporting is much smaller, but also our package set is much more succinct and really gives us the data that we need, not the data that is the data that we need to make good decisions, not just the data that was available previously. And we're always looking at ways, to streamline and improve our process and work with clients on providing the analytics that will allow us to continue